Bernard?
Yes.
Will the background disappear and I will be...
Sorry?
When I start, will the background disappear?
Yes. Yes, it will. It will.
Okay.
Winnie, I think you should go ahead and start. You're muted, Winnie.
Okay. Can you... Can you project me? Good afternoon, ladies and gentlemen, and good evening to our moderator who is currently in Bangladesh. It is an honor and pleasure to welcome you to the 4th edition of our webinar series. I hope and trust the session will be insightful and fruitful for everyone. Webinar 4, which is titled The Impact of COVID-19 on the African Continent's Prospects of Harnessing a Demographic Dividend, is part of a 5-part webinar series titled Demography and COVID-19 in Africa, Evidence and Policy Responses to Safeguard the Demographic Dividend. This webinar series is co-hosted by the Department of Social Development and Statistics South Africa in partnership with the UNFPA, the British High Commission to South Africa, and the Foreign Commonwealth and Development Office, the African Union, and Africa Center for Disease Control and Prevention, the African Institute for Development Policy, or AFIDEP, UAPS and PASA. Now, building on South Africa's data analysis and understanding of the epidemic and lessons from the rest of Africa and other world regions, the webinar series, as a key objective, seeks to create a space for sharing a demographic perspective on the impacts of COVID-19 with partners on the continent, considering its implications for Africa to reach a demographic dividend and achieve the SDGs. We anticipate that the webinar series will generate a level of consensus on core trends and findings amongst experts with which to formulate a set of policy options to recommend to national government as well as regional institutions such as the AU and SADC. So without further ado, allow me to introduce our moderator for webinar 4, Mr. Adnan Ben Haj Isa, the Executive Director of Partners in Population and Development of PPD since 2018. Before joining PPD, Adnan served the Tunisian government as a senior civil servant in different capacities at the National Board for Family and Population under the Ministry of Health of Tunisia. Over the 25 years of his professional career, he significantly contributed to the development of the Tunisian population and reproductive health policies and programs. He also worked with international development partners, influencing policy changes and program developments at the national, regional, and international levels. Mr. Aissa, I now hand over to you. Thank you.
Thank you very much, Winnie. Thank you for the introduction. I wish first say good afternoon, good evening for our participants joining us in this webinar. Allow me first to welcome all of you, all participants who are joining now this fourth webinar in a series of webinars organized by AFIDEP and the South African Department of Social Development, and wish also to thank all the partners who have been contributing in the organization of this series of webinars. We have very high-level panelists this afternoon. I just want to say that we are really happy to, PPD is also very proud to be part of this webinar organized by AFIDEP. We have been working with AFIDEP for quite many years now, and we have developed such activities together and also invited each other in different meetings and conferences like the International Ministerial Conference that the PPD is organizing every year. Without taking too much time, I wish to start by inviting our first panelist. And I wish to introduce Ms. Beatrice Mutali. Beatrice Mutali is the UNFPA representative for South Africa and country director for the Eswatini and Botswana country offices. She has over 25 years of experience in international and local development, including experience in program management, particularly around family planning and HIV/AIDS. Prior to her appointments in the East and Southern Africa ESA region, Beatrice served as the UNFPA Deputy Regional Director, Mikaro, and also the office in charge for UNFPA, Nigeria. Beatrice previously served as the Family Planning Director for Merck's MSD Oz Netherlands, head of the Africa team for the International HIV/AIDS Alliance, United Kingdom, and the Director of Program for IPPF Africa Regional Office in Kenya. She holds a Master of Art in Economics and a BA in Economics from the Kurukshetra, Haryana. Madam Beatrice, you have the floor, please.
Thank you, Chair, and good afternoon to all the participants. I trust that you can hear me. I would like to start, first of all, by really expressing appreciation to the Government of South Africa, the Foreign, Commonwealth and Development Office of the United Kingdom, AFIDEP, and all the partners that have been involved in organizing this webinar series that have been extremely helpful. Colleagues, many of you may recall that it is exactly a year since the landmark Nairobi summit, and since then, old and new challenges have emerged that could hamper progress towards achieving the ICT agenda. But that said, we will not retreat. The road ahead may be steeper than before, but our march forward will continue. The COVID-19 pandemic has made reaching our goals for access to sexual and reproductive
There is a problem of sound. Beatrice, we can't hear Beatrice. Sorry.
Hello, can you hear me now?
Yes, yes, now I can.
Okay. All right. I don't know where to start from, but okay. But I hadn't gone too far. So what I was saying is that the COVID-19 pandemic has made reaching our goal of universal sexual and reproductive health and rights much harder. The pandemic has limited women's access to services that protect their health and rights, putting them at risk of unintended pregnancies. Insufficient maternal health services are threatening the lives of mothers and newborns. The pandemic has also caused a devastating spike in gender-based violence and subjected millions of girls to child marriage and female genital mutilation. Vocal groups are using the pandemic to revive their efforts to undermine women's autonomy. But we will adapt, we will innovate and regroup, and we will prevail. The partnerships that we built at the Nairobi Summit are strong enough to weather the storm. In Africa, South Africa is one of the countries that has most been affected by COVID-19, having over 730,000 confirmed cases, over 19,000 deaths, and over 660 recoveries as of 5th of November 2020. That said, we strongly commend the government of South Africa for the rapid coordinated response, including the inclusive engagement with all stakeholders, engagement with civil society, private sector, development partners, including the United Nations. We noted good practices, such as the evidence-driven, comprehensive health and socioeconomic response to mitigate the multidimensional inequalities. COVID-19 is a complex issue, significantly impacting the pursuit of sustainable development. Dear participants, we started our march to the world of rights and choices over 25 years ago. The Nairobi Summit that was held last year re-energized us to reach our destination by 2020. We all recall that the International Conference on Population and Development in 1994 established a consensus that sexual and reproductive health and rights are a bedrock necessary for growth and prosperity. Today marks 1 year since the 25th commemoration that took place in Nairobi. The Nairobi Summit re-energized the sexual and reproductive health movement. It mobilized political will and generated over 1,250 commitments, all of which are aimed at achieving the goal of the ICPD and sustainable development by 2030. The summit was a watershed moment that brought people together to save lives, lift millions of women and girls, their families and communities from exclusion and marginalization, and enable nations to reach the benefits of a demographic dividend, thereby growing their economies. The Nairobi Summit secured billions of dollars in commitments from governments, from the private sector, foundations, and others. It rallied support to achieve the 3 zeros: zero unmet need for family planning, zero preventable maternal deaths, zero gender-based violence and harmful practices. The breadth and volume of the commitments made during the summit are proof that the world is serious about realizing the transformative agenda for women and girls. Therefore, despite the many challenges, we must not lose momentum. In Nairobi, the government of South Africa recommitted itself to some of the following. It recommitted to achieving universal access to sexual and reproductive health as part of universal health coverage. It recommitted to addressing gender-based violence and harmful practices. It recommitted to mobilizing the required financing to finish the ICPD program of action and sustain gains already made, and also recommitted to drawing on the demographic diversity to drive economic growth and achieve sustainable development. And also, the government of South Africa recommitted to upholding the rights to sexual and reproductive health care. Today's webinar really builds on the overall, on the webinars that have held prior to this. And the purpose of this is really to focus on the policy action to sustain progress towards the demographic dividend in the context of COVID-19. The expectation also is that the webinar will prepare us to better respond to future pandemics and future health emergencies. On behalf of UNFPA, I wish the facilitators and the audience a fruitful exchange of ideas and experiences. UNFPA looks forward to participating in the discussions during this webinar and also looks forward to the discussions that will take place in the fifth webinar, where the overall recommendations of the webinar series will be discussed. We have never been closer to realizing sexual and reproductive health and rights for all. We will not turn back now. At national level, UNFPA will continue to collaborate with governments and national partners to achieve the ICPD plan of action. I thank you.
Beatrice, thank you for your excellent presentation and also for respecting the time that has been allocated to you. Thank you for highlighting the many issues in your presentation. Hello? Yes? Okay, sorry. Highlighting the issue of reaching universal access to reproductive health and family planning under this COVID-19 situation becoming very hard, and that the pandemic has caused severe impact on gender-based violence also and on maternal and child health. You also mentioned about the rapid response of the government of South Africa to face the COVID-19 and the importance of facing all the issues, particularly to ensure reproductive health and family planning to the citizens and also to women and to the population in South Africa. You also highlighted the Nairobi commitment 1 year after the Nairobi commitment has been taken, and that has been the movement on reproductive health and family planning has been energized. And we have seen that although we are facing the COVID-19 situation, but there are progress made by many developing countries to implement activities under these conditions. You also mentioned about the securing the billions of dollars of commitment to achieve the 3 zeros: zero maternal mortality, zero unmet needs and family, and zero gender-based violence. You also highlighted the South African recommitment to ensure universal access to reproductive health. And thank you for the availability of UNFPA to support this webinar and also to be ready to contribute to the discussion and to this fruitful meeting. Thank you very much again. And now I wish to invite Dr. Bernard Onyango. Bernard Onyango is a senior research and policy analyst at the African Institute for Development Policy, AFIDEP, and leads. Oh, sorry. I think, yes, Bernard, you're right. I need to first invite Mr. Nurdin Hassan, who will make reflections on the webinar 3. Nurdin Hassan from AFIDEP.
Yes, thank you very much, Adnan. Good afternoon to you, ladies and gentlemen. My name is Nurdin Al-Hassan. I work in AFIDEP at the Malawi office. So last week's webinar, which focused on the impact of COVID-19 in South Africa and the social protection measures that have been put in place to mitigate the effect of the pandemic, was actually the third in the series of webinars. Now, in that webinar, the focus was looking at how the pandemic affected South Africa. We also had a presentation from a youth advocate on how the pandemic especially affected young people and how they are coping. And the webinar also brought into bear the perspective of the SADC, showing the regional responses to the pandemic. Now, the webinar showed clearly that South Africa is one of the countries that has mostly been affected by the COVID-19 pandemic. It's a country registering the highest confirmed cases and deaths in Africa.
Good morning, excuse me. Good morning, excuse me.
Yes, Nordin, please, you can. Okay, you can.
Okay, so the reason why South Africa recorded some of the highest cases and deaths had to do with the very comprehensive testing regime that was put in place by the government. And the response and measures that were put in place were quite strict, especially to deal with the lockdown. And these lockdown measures came at a time where the South African economy was generally growing slowly and also in a situation where unemployment was very high, especially among young people. So COVID actually amplified some of these challenges that already persisted before the pandemic. Now, despite having some of the best response measures for COVID in the continent, there were also challenges to do with how the measures were implemented. There were challenges to do with structural challenges, bureaucratic bottlenecks, and there were issues of inclusivity. Some of the evidence that were shown in that webinar clearly demonstrated that job losses was one of the key challenges faced by South Africa posed by the pandemic. And there were issues of mental health issues being aggravated by the pandemic, and then also inequalities in school attendance. But the webinar also showed that some of the responses that were implemented actually had positive impacts that were wider than initially anticipated. So, for instance, the National Income Dynamics Survey's Coronavirus Rapid Mobile Survey showed that some of the people who prior to the pandemic were not roped into the social grant system were reached due to the measures that were implemented. There was also a decline in hunger and child nutrition, and a decline in hunger among children and households due to the measures that were implemented. And the evidence that was presented in that webinar clearly showed that having data at this time is very useful for decision making. This means that countries like South Africa and the rest of us in the region actually need to emphasize the need for data in this time and also for interventions going forward. Now, all on the presentation from SADC, clearly it shows that regionally the pandemic affected countries, and all countries experienced some negative change in GDP per capita growth, with countries seriously affected, especially countries such as Seychelles and Mauritius, which relied heavily on tourism. COVID really affected those countries. If you look at the analysis, the measures provided by the SADC countries, it revealed that most of the measures that were implemented were quite new, showing that prior to COVID, the number of social protection measures that were put in place were quite low. So this calls into question about whether some of these new measures could be sustained going forward. I think with these remarks, I would like to end here, and thank you very much for the opportunity to recap the last webinar. Thank you.
Thank you very much. Thank you very much, Nordin Hassan, for your brief intervention and very focused on the major recommendation and also outcome from the previous webinar. Now I wish to invite Dr. Bernard Onyango. Bernard Onyango is a senior research and policy analyst at the African Institute for Development Policy, AFIDEP, and leads the Population and Sustainable Development thematic area. He has extensive experience in the field of population and development, and his recent work has focused on providing technical expertise to various governments and development partners on the demographic dividend across Africa, including the identification and implementation of policy options to empower women and youth to harness the dividend, the demographic dividend. Bernard obtained his doctorate and master's degree in sociology, social demography, and urbanization from Brown University. He's a member of the Union for African Population Study, UAPS, International Union for Scientific Study of Population, IUSSP, and the Population Association of America. Bernard, you have the floor. And please stick to 12 minutes for your intervention. Thank you.
Thank you very much. And thank you all for joining in for this session today. I hope you're going to find this useful. So the work I'm going to present today is supported by UNFPA, and what we were interested in was to actually do a synthesis of the evidence on the impact of COVID-19 on the demographic dividend pillars in Africa. And so I'll just start by going back to a definition, just to make sure that we are all on the same page. So what really is the demographic dividend? You can think of it as the economic benefits arising from a significant increase in the ratio of working age adults relative to young dependents. And this happens when birth rates decline significantly and the age structure shifts in favor of more working age adults, which can then help accelerate economic growth through increased productivity, greater household savings, and lower costs for basic social services provided to dependents, especially children. But I think the key thing here to note is that the demographic dividend is not guaranteed by that shift in age structure alone, but must be accompanied by investments in human capital development, including health, education and skills development, and promoting an enabling environment that provides opportunities for decent jobs and livelihoods. So in the recent past, African countries and members of the African Union have really bought into the idea of investing to harness the demographic dividend in Africa, as has been done in other world regions. And in 2017, the African Union came up with a roadmap on harnessing the demographic dividend through investments in youth. So this particular roadmap has got 4 key pillars. One is employment and entrepreneurship. The other is education and skills development. Then health and well-being, and under health and well-being you have the reproductive health and also family planning. And then you also have the 4th pillar, which is the rights, governance, and youth empowerment. And through the document, there's this cross-cutting interest in equity and empowerment of women. So I just wanted to give that background before going into what we are seeing on the COVID-19 impact on the demographic dividend. So what we are seeing emerging is that they're both emergency and long-term impacts on health and well-being, education, employment and livelihoods. So these three sectors in particular are the ones that I'm going to stick to. And this will have a bearing on the demographic dividend in Africa, and therefore we need to understand the potential impact in order to mitigate negative effects on the potential to harness the demographic dividend in Africa. So while it was initially feared that Africa could suffer the brunt of the immediate impact of COVID-19 because of such factors as having weak health systems, high levels of poverty, crowding in urban areas, and so forth, The region has so far had a relatively small proportion of its population affected, accounting for about 2.7% of more than 50 million confirmed cases to date, and about 2.4% of the more than 1.2 million confirmed deaths globally. However, as you can see from the charts, we really are not out of the woods yet. In the past, we could see there was a bit of what looked like a peak in the continent around August, but in recent weeks we've been seeing a rise in cases in countries such as Kenya, Algeria, and Uganda, and this also coincides with the loosening of the restrictions that had been put in place previously to mitigate the spread of the pandemic. So we don't know, it's an evolving situation, and much still remains to be seen on how this is going to pan out in coming months. So just thinking about the implications for the health and well-being, and a lot of work has been done, and in our synthesis of the evidence, we noted the short the health in health sector services that have included negative impact on family planning and sexual and reproductive services. There's also been indication that vaccination campaigns and programs have been disrupted across the region. There's also the real risk of, and especially at the height of the emergency responses, the diversion of resources to from other critical healthcare needs to COVID-19 response. So you can think of the likes of TB programs, malaria programs, and so forth. Reports have also indicated an increase across the continent, really, on gender-based violence, unintended and teenage pregnancies. So these are real issues which have implications for young people, for example, on teenage pregnancies going forward. The long-term health consequences are still not well known, but obviously we expect that various areas will be affected, including sexual and reproductive health, evidence emerging of mental health issues, and also nutrition. So I'll just move on to education and training, which has also seen massive disruptions. So in the map that's on my screen right now, there are 3 of them. We are looking at 3 time points, and this is from data from UNESCO. March 10th, which was just at the beginning of this in Africa. I think the first cases had just been discovered at the time. And then we have May 10th, which is more or less well into the closures of school and so forth. And then we have November 10th. So as you can see in the first map, schools were basically open across the continent. So that's in the blue color. And by May, we had closure almost across the whole of Africa. So the purple, that purple color signifies the schools being closed due to COVID-19. But as I said, more or less, most countries started opening up again, opening up the economies, opening up schools, movements by September or thereabouts, and by November, we can see that many countries have resorted to fully opening their schools, but there's still quite a number that are having either partial opening of schools. So the implications for these school disruptions are actually quite many. In my own country, in Kenya, initially schools were shut down for the whole academic year. We've now resorted to partial reopening. But we expect that because of the school closure, there are going to be dropouts. And it's estimated that about 5.3 million learners in sub-Saharan Africa are at risk of not returning to school in 2020. These school dropouts also associated with child marriages and teenage pregnancies. But also, what has happened is that there's been a rising sort of inequality, especially during the closure period, because there are certain groups within the population that were able to still be able to access learning platforms, such as the online learning platforms and teleconferencing platforms that were being used at the time, delivery of curriculum through radio and television. But there were challenges, especially for poor and rural communities who were unable to access these alternative platforms for in-person, as compared to in-person training. And also, there's evidence around females being disadvantaged when it comes to digital learning. But another major challenge of the curricula and teacher training has not really been designed for effective delivery of education and training on these alternative platforms. But really, the big elephant in the room is portrayed by this cartoon here. It says, has the COVID standing in the middle there, the Grim Reaper, and demand and supply. And so there's been this question about, do we eat or do we heal, or do we open up the economy, or do we put restrictions that are going to make sure we stay healthy? So there is the debate not going on all over the world. So it's not just Africa, and we've seen very sharp debates, whether it's in North America or in Europe, which is now undergoing a second wave of COVID-19. So strict lockdown and other restrictions severely affected livelihoods. We've seen massive job losses and reduced income, especially in the informal sectors and urban areas. And for most countries, this period has also exposed the lack of formal social safety nets to support families that are in need. The urban to rural migration during the restriction of movement also as a coping strategy when the economy shut down and people lost jobs. There are groups of people that resorted to moving back to rural areas. And then we also know that this recovery will take long, and the World Bank is projecting a recession in the region for the first time in almost a quarter of a century. And there is also the issue around reallocation of resources for emergency needs and borrowing, which will limit fiscal space for investments in critical social sectors needed to harness the demographic dividend. So the UN's Economic Commission for Africa has projected that a 1.1 growth rate in 2020 under the best case scenario, and a contraction of up to negative 2.6% in the worst case scenario. 19 million people are projected to be deprived of their livelihoods, and 29 million people will be pushed into poverty in the context of weak social protection programs. So I'm sort of running out of time, but I just had a couple of slides here that I wanted to show from a GeoPoll study that was conducted in 5 countries across the region on how COVID-19 has impacted on incomes and socioeconomic life. So in this particular question, for example, you have the current COVID-19 impact stopped you from being able to work? And we can see that significant proportions of the population across these 5 countries were affected. And then there was the issue of whether you received any form of aid since the COVID-19 crisis started. And pretty much upwards of 80% of the population in these 4 countries had. And for those, I think an interesting thing to see before I come to my last slide is where the aid was coming from. So you can see in South Africa, for example, 50% received aid from the government as compared to 18% in Kenya. And so there has been that sort of variation across the continent. Some countries such as South Africa have been able to do a much better job and have had social protection measures inbuilt even prior to the pandemic. So one last thing I wanted to say is there's really the big challenge around data. So there's a lack of data, which has undermined response. For example, targeting of emergency support and cash transfers to vulnerable groups. And the implications for also measuring the long-term impact of the pandemic. There've also been critically disruption of routine and periodic data that's used to inform health and socioeconomic sectors, including DHS and population and housing census, which have been had to be suspended in some of the countries. So not getting timely data from those sources will be problematic. But on the bright side, there've also been innovations and adopting new approaches, or even if they are not new, the approaches that have not been leveraged as much in the past in the continent as compared to in the global north. So we have telephone interviews, and we have SMS surveys and other forms of digital surveys. So in conclusion, what I'd say is that the pandemic is still evolving in Africa, and we are already seeing evidence of the negative impact on the potential to harness the demographic dividend in Africa. Quantifying this impact will be an ongoing process for now, but critically, it's important to put in mitigation measures right now so that we have a better chance, and also learning just from the lessons from the responses, of which you will see. I think one of the other presentations coming after me is going to talk about what lessons we are learning from responses that government put in place to contain the pandemic. Thank you.
Thank you very much. Thank you, Bernard. It's a very good presentation, and you have highlighted the impact, of the COVID-19 in African countries. As also you mentioned, education and employment has been mostly affected in Africa. In fact, not only in Africa, in even other countries. With the although the rates in Africa are rates of infection and also death are not that much higher than in other countries. But it seems that the situation in some countries now it is increasing. You have also highlighted the implication for health and well-being and the suspension of programs, the reproductive health programs, and also vaccination. That also was caused by the strict lockdown, which was imposed on almost in all countries. Education, you mentioned that it has been massively disrupted. This is also important, and the risk of 5.3 million young people will not come back to school. That should be taken into consideration. Yes, the impact of lockdown on our livelihood has been affected too much, very seriously, and you have come out with the conclusion that pandemic is still evolving in Africa. Yes, in all countries, in fact, in all Africa. But in Africa, we have to take strict measures. Our governments are called upon to, impose strict measures so that the infection will not spread. Thank you very much again. Now I wish to call our third panelist, Mr. Nicholas Uma. Mr. Nicholas Uma is a senior youth advisor at the African Union Commission in Addis Ababa and has over 20 years experience in education and youth development. He previously served in various capacities in Kenya, including as country director of youth development, lecturer, and district youth officer. Mr. Nicholas blends a formal background in curriculum design and development, implementation and evaluation, and a proven track record in delivering on youth development and empowerment outcomes at both national and continental levels. He holds a master's degree in education education, communication, and technology. He is adept at interpersonal communication and working across a diverse cultural setting, fostering social change through engagement with policymakers, academia, private sector, and civil leaders. So Mr. Nicholas will present the reflections on COVID-19 and the youth in Africa and lessons from the Demographic Dividend Youth Initiatives. Mr. Nicholas, you have the floor.
Thank you so much, moderator. I don't know my presentation, if it is up. Somebody was assisting with putting up my presentation. Next slide, please. So my presentation will be on the youth demographics in Africa, our mandate as the African Union, COVID and the youth, and ongoing initiatives, and then opportunities and conclusions. Next slide, please. Yes, most of this has been spoken to by my colleague, Dr. Bernard, and I want just to mention briefly on the fact that Africa's youth is the most youthful continent, with about 40% being between the ages of 15 to 35. And this has the potential for immense growth in Africa's labor force over the next few years. This burgeoning youth population is facing a myriad of challenges. Some of these challenges have been mentioned by Dr. Bernard, accessing training opportunities that will then enable young people to secure decent work. The issues of unemployment, underemployment, and health challenges are among the most critical challenges that young people face. Next slide, please. So youth development, next slide. I've spoken to this, yes. Youth development in the programming in Africa has greatly evolved over the years, starting from the development of the African Youth Charter in 2006. This was a political and legal strategic framework for youth empowerment and development in the continent. For its implementation, there was the development of the Decade Plan of Action, lasting from 2009 and up to 2018, which was a framework for multi-sectoral and multi-dimensional engagement towards the implementation of the African Youth Charter. Then came the premier Continental Development Blueprint, Agenda 2063, and of special note in Agenda 2063, particularly for young people, is Aspiration 6, that talks of an Africa where development is people-driven, relying on the potentials of its women and youth and caring for its children. This is important because this is the document that is currently foregrounded and foregrounds the development trajectory of the continent over the next 50 years. And then the theme of the year in 2017, and this has been spoken to also by Dr. Bernard, on harnessing the demographic dividend through investments in youth, with the 4 critical pillars, which have also been spoken to: the employment and entrepreneurship, health and well-being, rights, governance, and youth empowerment. And most importantly was the intention and need for targeted investments in these areas so as to enhance youth development. Member states were called upon to develop demographic dividend profiles that will serve as a monitoring tools for the implementation. Then, upon the lapse of the Decade Plan of Action, the African Union has just developed the African Plan of Action for Youth Empowerment. This is a plan of action for implementation of African Youth Charter, the accelerated implementation of the decisions on harnessing of the demographic dividend, and also targets on youth as set out in Agenda 2063, 10-year implementation plan. Next slide, please. The plan of action has 3 critical strategic action areas. The first being strengthening of foundations for youth programming in the continent. And some of these foundational aspects for youth programming include the mechanisms for youth development, the platforms, be they continental or national platforms for engagement, policy and programmatic frameworks, the communication networks and platforms, among other key enablers for the implementation of the plan of action, plus also the implementation of the 1 million by 2021 initiative, which is currently ongoing. Then the second critical area is catalyzing action at member states level. This is where rubber meets the road, and it is critical in the implementation of the plan of action for accelerated programs in member states and a multi-sectoral technical support teams for the implementation of priorities as set out by the member states. And lastly on this is the inter-country peer reviews on what works, what has worked, and what needs to be upscaled towards in other countries as they seek to engage. Then the third critical area is the implementation of the continental flagship programs. These include the digital skills ecosystem development, the focus on education and skills, the alternative pathways and models for learning, and nurturing of enterprises, particularly enterprises for youth. So once implemented, we believe that this will be focus areas that would enhance youth development in the countries, particularly through cascading model from the African Union Commission through member states, and even within member states, having these 3 focus areas cascaded to the local level, where we have foundations being strengthened, catalyzing action at member state and regional levels, and also implementing specific flagships. Next slide, please. Why African Union Commission? We believe that through the convening power to mobilize and synergize and leverage national and international stakeholders towards the common goal, bringing together governments, youth voices, civil societies across various sectors to leverage on their various strengths in the implementation of youth development agenda. One of them is the 1 million by 2021 initiative. I'll not go into details on this, which has been mentioned. I'll move to the next slide. The 1 million by 2021 initiative is just an example of the foundational programmatic framework on offering concrete opportunities to young people in the areas of education, employment, entrepreneurship, engagement, and cutting. COVID-19 pandemic has the potential to exacerbate the challenges that we seek to address, these challenges faced by young people, and erode the gains so far in all the critical areas of the demographic dividend agenda. The expected drop in growth from COVID, and this has also been spoken to by Dr. Bernard, who mentioned the potential at the worst case scenario of a 2.6% drop. And this is not good. Next slide, please. So the potentials of the disruptions have been mentioned, particularly in education, deepening poverty, the issues of unemployment, situation concerning the vulnerable groups. It is a very grave issue, particularly the risk of young people not getting back to school, the 5.3 million not getting back to education institutions, and also the health challenges, including the mental health. What do we do, and what has the African Union been doing on this? Next slide, please. The scope of youth response revolves around reducing the health risk, minimizing the impact, and mobilizing and engaging youth as respondents. The critical element on this is an intergenerational solidarity and collective responsibility, the joint effort needed among critical and key stakeholders in addressing potential impacts and mitigating against these potential impacts. Next slide. Then we have the education response, the alternative learning pathways, digital tools, particularly an emphasis on digital connectivity, online and offline learning, a focus on teachers as facilitators and motivators of learning, and the issue of safety, both online and offline, as critical areas. We are calling this the dots-based framework of intervention, continued learning mechanisms, and then documenting good practices, knowledge sharing, and peer learning, and the plans to reopen. And not only to reopen schools, but what plans are we putting in place to address particularly the 5.3 million whom we have been told are at risk of not returning to school. Next slide. I want to mention some of the ongoing initiatives next slide, not this one, next slide. Yes, these are currently ongoing initiatives, strengthening of towards education skills initiative for Africa program, where we aim at strengthening occupational prospects for youth in the continent within the African Continental Qualification Framework, and strengthening the skills anticipation and labor market information systems inform on what needs to be done to improve on the skills gaps. And then we also have the Young Professionals Program. Premier of it is the African Union Youth Volunteer Program, offered for the professional development and leadership skills for young people, and also youth engagement interventions, working with young people across the continent on issues of concern that affect them through a mainstreaming frame. We have been undertaking virtual engagement with young people in Africa, leveraging on youth and partner networks to ensure that young people are involved in the development and interventions related to COVID. Next slide, please. What are the opportunities and proposals moving forward as we conclude? It's important that there is a holistic integrated approach with youth at the center, increased and continuous investments in key areas to exploit the demographic dividend, strengthening coordination mechanisms to ensure that there is mutual accountability. The fourth is fostering innovation, entrepreneurship, assisting with the business development services, particularly for young people. I know member states have been doing an amazing job in this, and the figures have been presented also by Dr. Bernard. And the fifth is building evidence-based, particularly on progress and what has worked to inform policy. It's important to strengthen research, particularly on youth work. The dearth of data that has been mentioned also in the previous presentation must be addressed, and urgently. Then the final slide, last slide. Next slide, please. There is a next slide, not this one, previous slide. Yes, this slide. The journey ahead. COVID-19 has found us on a journey, and I've tried to enumerate the journey where we have come from as a continent, particularly with policies and programs. We should on this journey, and we should not be derailed by COVID. And despite COVID being a major impediment the journey as envisioned in the African Youth Charter, Agenda 2063, the African Plan of Action, among other instruments, must continue. We have the tools, some of which I have enumerated, and more tools should be developed through frameworks and processes as we are having today in order to make it work and to maximize potentials of youth development in the continent. Thank you so much. And I apologize that the slides were not very, very clear, but I believe I've managed to express the issues relating to where we have come from, where we are, and what we need to do as we head forward. Thank you so much, moderator.
Thank you very much. Thank you, Mr. Nicholas, for your excellent presentation, highlighting the importance of youth and impact of COVID-19 on youth different aspects, particularly as the youth percentage is around 40%, which is a great potential in Africa with the age between 15 and 35. Also, you highlighted very impressively the education, training, health, decent work, which are the main challenges faced by the youth in African countries, in the African continent. Also mentioning the African Union Plan of Action for Youth Empowerment, which is founded on 3 critical aspects: strengthening foundation for youth programming, catalyze actions at member states level, and inter-country peer reviewing. I wish to also thank you for highlighting the importance of the scope of youth response in Africa and the initiative taken by the African Union for youth to face the impact of COVID-19. As you mentioned, yes, we need a holistic and integrated approach is needed to be adopted to build resilience. In fact, the COVID-19 response should be based on a national unity, and all stakeholders at the national level are all responsible to face the COVID-19. Government, private sector, media, parliamentarians, and also all the those who are involved in the fight against COVID should put their hands together, so that the fighting of the COVID-19 is important. I like your also the last slide, which is about the journey ahead for the COVID-19. Yes, we are still facing challenges of the COVID-19, although we heard about the vaccines that we now happy to hear about that. But I think the fight is still long, and we have to continue to take our strict measures so that the spread will not continue in our African countries. Thank you very much again. Now I would like to invite Dr. Jean-François Koubiané. Mr. Jean-François Koubiané is an associate professor of demography at the Institut Supérieur des Sciences de la Population, ISSP, Université Joseph Kizerbo, Ouagadougou. He has previously worked at the National Statistical Office of Burkina Faso. He is a dedicated member of various professional associations of population scientists and is a member of the International Union of the Scientific Study of Population, IUSSP 2018 from 2018-2021 Council, and former president of the Union of African Population Studies, UAPS, between 2012 and 2015. He holds a Bachelor in Economics from the University of Ouagadougou, a Master's degree in Demography from the Institut de Formation et de Recherche Démographique IFORD in Yaoundé, and a PhD in Demography from the Institute of Demography at the University Catholique de Louvain, Belgium. Dr. Jean-François Koubiané will present to us the lessons that can we learn from Africans' response to the COVID-19 pandemic. Jean-François,
okay.
You have the...
Okay, thank you, Mr. Moderator. Are you seeing my presentation?
Yes.
Okay, thank you. So I want to start by thanking the organizer for this very, very important webinar and for inviting me to reflect on what are the lessons we can learn from the Africa's response to the COVID-19 pandemic. I want to say that this is really an exciting exercise, but I do have to confess at the same time that for many reasons, it's not an easy task. We are just starting to learn from this crisis, and we don't have enough body of knowledge in terms of evaluation report on other analysis of the responses which have been given to the pandemic on the continent. So I will actually try to grab some information from my experience in Burkina, but also what we have tried to get from some websites of national response teams, and also some very rare report highlighting the issues of the pandemic and the responses given. And I also want to focus on Western African countries. So I've taken the example of the 15 countries of ECOWAS, the Economic Organization of West Africa. I'm trying to move on my presentation. It's not working.
Can we move to the next slide, please? I think it's okay now. We can.
Jean-Francois, I think you're muted.
Can you please come back to the former slide? Yes, the previous one. Yes, please.
Okay.
Okay, yes. So I just want to recall the outline of my presentation. A few words in terms of introductions, and I will give a quick view on the pandemic in the sub-region, the 15 countries of ECOWAS in Western Africa, and also give an idea of the measures taken in the region, the sub-region. I will also talk about measures which have, we can say, had dramatic consequences in different aspects of people's lives, and also measure with potential long-term positive impacts. And finally, some concluding words. Next slide, please. Okay, so as already mentioned, the COVID-19 pandemic is an unprecedented health crisis affecting all aspects of people's lives. It is occurring in a context, particularly Western Africa, already characterized by many challenges and conflicts, terrorism attack, political unrest. The rapid mode of transmission of the virus and the lack of a cure have led governments to put in place, to varying degrees, drastic measures to limit the spread of a disease. So what can we learn from this measure taken by Western African countries, and particularly the 15 countries of ECOWAS? Next slide, please. So a quick view on the pandemic in the sub-region. Next slide. Okay. So while it seemed to be a distant concern, The COVID-19 became an issue for the continent by late February. The first country in the ECOWAS area to declare official cases in Nigeria. It was in February, and 27th of February. And the last country to report is Sierra Leone on the 31st of March. As of November 10 to 2020, we have a cumulative number of almost 200,000 cases of COVID-19 in this sub-region of a continent, and 2,700 deaths, representing respectively 14% and 11% of the cases on the continent. Next slide. So this graph gives you the distribution of a number of cases, cumulative cases and cumulative deaths in with the 15 countries of ECOWAS. And as you can see, Nigeria is coming ahead with the biggest number of cases, followed by Ghana and Cote d'Ivoire, and the smaller number are recorded in Niger and Liberia. But there is a need for caution when comparing these figures for many reasons. We know population size is very different, from one country to another one, but also because the methodology of the tracking of cases differ from a country to another one. So we have to take some caution when we are comparing this figure. But it gives us an idea on what is the magnitude of a pandemic in this sub-region. Next slide, please. So in order to face this pandemic, so almost all the countries in the ECOWAS area have taken some measure to face the pandemic at different, as I said, different degree. And this table gives you an idea of what have been the measures taken to face the pandemic. So it's not an easy task. We have tried to go through the website of national COVID-19 response teams and diverse sources to try to see what have been the measures taken at the country level, to face, the pandemic. So we have categorized this in 4 categories: what we call cross-cutting measures, measures in the education sector, in the health sector, measure in the trade sector, measure in the field of transport and mobility, and what we call other measures. So as you can see, the issue of prohibition of large gatherings, crowded events, closure of entertainment halls and closure of churches and mosques, and also closure of school and university, use of facial masks, closure of land borders and land borders are those measures who have been widely actually put in place by all countries. You can see that all the 15 countries of ECOWAS have, taken measure in that direction, to face the pandemic. And what you put in red are measures which have been taken by at least half of the countries. So at least 7 countries out of 15. And you can see that curfew, quarantine of cities, and hand washing, and it's somewhat surprising to see here that hand washing was not something widespread. We have get information on, we have actually found that just 7 countries are actually put in place a clear measure in terms of hand washing. We also have quarantine of confirmed cases and contact persons, closure of major markets, closure of restaurants, closure of intermittent places, and we also have a measure, but these are some of the key measures actually which have been taken by countries in this sub-region. Next slide, please. So what can we learn from the effectiveness of these measures? And 4 points we want to highlight here. The first is the fact that we think countries have been really responsive in terms of reacting to the pandemic. You know, when you look at the time the first official case has been, reported, and the decision taken after that, it was something that was very, very, very quick in many of the countries. So in some extent, even though we don't have a lot of evidence on it, we can say that this measure in some extent had an impact on the magnitude and the spread of the disease. But one of the things we have to mention is the issue of the governance of the pandemic. And in many countries, a national response team has been put in place. But most of the time, this national team was a body which was actually disconnected from the health system structure. It was not like something which was embedded in the health system structure, because in all the health systems on the continent, we have some bodies, administrative bodies. We are taking care of pandemics, epidemics, and pandemics. And in some countries, the national responses were actually, a very different, structure put in place, which was not necessarily connected to the health system. So this is one of the issues is important to highlight, and it has consequences in terms of the coordination of the response to the pandemic. And in terms of governance also, Rajan and co-author has published in last May a paper on the governance of the pandemic in different countries around the world, including some African countries. One of the key lessons we can learn from that research, that this national response team were not actually so multidisciplinary, and there is a lack of representativeness of the civil society in these bodies, and this is also one of the limits of this issue of governance of the pandemic on the continent. We also had a challenge in terms of around the pandemic, and when I'm talking about communication, we had a lot of issue, regarding the attitude of some health staff personnel, but also health facilities, regarding their willingness to welcome some patients in health facilities, but also patient was also reluctant because of the communication, and sometimes a very bad communication around the pandemic. And so this also had an impact on the attitude of the population towards the use of health services during the time of the pandemic. And another issue we want to highlight is the issue of representation on the disease that do not is compliant with the barrier measure. And my organization, ISSP, conducted a research recently, a few months ago. We clearly show that we have this representation like that the COVID-19 was it was a disease of healthier people, and it was not occurring in all the part of the cities, but in the wealthier neighborhood of the city. So all of this issue actually didn't help enough, to improve the use of the barrier measure. Next slide, please. So, and we had finally some measure with dramatic consequences in different aspects of people's lives. Next slide, please. One of the aspects, even though we think that this measure probably had, no, please, the slide before, please. Previous slide. Previous slide, please. Okay, so one of the aspects we want to highlight in terms of, measure who had some potential bad consequences on people's lives is the measure taken in the economic sector. And in African cities where a large majority of the working population is in the informal sector and where many of them earn their income on a daily basis, the closure of market, restaurant, and other entertainment place has had and will have negative consequences on household income. We also have the closure of school university, which have been already highlighted by previous presentation. And even though we had alternative measures proposed by the Minister of Education, like TV program, online courses, we know that not all the households in cities have access to a TV program and even to internet. And all these measures will ultimately impact negatively the quality of education. And it is the poorest population who will suffer the most. The dysfunction in communication have led to some kind of reluctance, both on the part of the population to seek healthcare services, but also on the part of some health staff and health facility to welcome patients who seem to have COVID-19 symptoms. These consequences will, in some extent, exacerbate inequalities. Next slide.
Bernard, you have 2 more minutes, please.
What? Yes, I am almost done. But we also have measures with potential long-term positive impact. And next slide, please. Hand washing in public areas has become more widespread in this time of COVID-19. And even if we observe a kind of relaxation, the practice seems to be more widespread than before. And such a change in behaviors could eventually have a positive effect on reducing the prevalence of some infectious disease in the long term. And also the use of facial masks is also a practice that has been more common with the COVID-19 pandemic, and particularly in the context of West African countries, and particularly the Sahel, with the Harmattan, which set in between November and January, and with its consequences of dry and cold wine and dust. The continuous use of facial masks will help to limit the spread of some disease. Next slide, please. So these are my concluding words. Next slide, please. Next slide, please. So in terms of conclusion, the drastic measure taken to slow the spread of a coronavirus disease probably had a short-term effect on the magnitude and spread of a disease in West Africa, even if we still have a little evidence to highlight this. Some of these measures, such as hand washing and use of facial masks, if they are promoted and maintained, could have positive effects in the long term, reducing the prevalence of the disease. But governments must learn from the governance of this health crisis, whether in terms of the monitoring of the cases or in terms of measures taken. Some measures taken, particularly in the economic sector, have had and will have negative consequences on household income, thus ultimately compromising the access to basic social service and therefore the prospects of harnessing a demographic dividend on the continent. And I want to close my presentation by this quoting from the paper from Rajan and Kof. So this is the next slide. This is important to have. It's important to have it on mind. And I just want to just 1 minute. I have it here. When they say that in the end, we must ensure that we more harm than good with the measures in place to protect our at-risk population. Thank you for your kind attention.
Thank you very much. Thank you, Jean-Francois, for your excellent presentation, highlighting the situation in ECOWAS region. Also showing the measures taken by countries of the ECOWAS, which have proven to be effective to reduce the spread of the virus in the ECOWAS African countries. You know, it's important to learn from our different experiences, particularly in Africa, since I strongly believe that experiences in African countries are easy to share and easy also to be adapted to the context of the African countries. The fight against COVID-19 needs, as I said, the solidarity between the African countries. And particularly South-South cooperation is also important when dealing with not only face the crisis of the pandemic, but also to share the important experiences and the rich experiences that we have in our countries, so that we can promote our social and also economic programs. Thank you again, Jean-Francois, and I wish now to, as we are finished with the panelists, I wish now to invite our discussant, Ms. Duduzile Simelane. Ms. Duduzile Simelane is the Director of Social and Human Development at the Southern African Development Community, SADC Secretariat. She has been the Head of Strategy, Performance, and Organizational Development at the IPPF Africa Regional Office, and also served as a team leader, East and Southern Africa at the IPPF African Regional Office. Prior to that, she was Regional Manager, East and Southern Africa at the International HIV/AIDS Alliance. She has also served as the Executive Director of the Family Life Association of Swaziland and as Deputy Executive Director and Director of Programs. She is a seasoned conference speaker who has presented papers at several international conferences. She holds a Master in Development Studies from the University. Sorry. I lost my paper, sorry. You can, from University of South Africa, among other academic qualifications from the University of Swaziland and the University of Manchester. So, Madame Duduzile, you have the floor and to share your thoughts. Thank you.
Thank you, and good afternoon to everybody. First, let me thank the organizers for inviting the SADC Secretariat to this webinar. We've participated in several, including the one last week, and I'm taking the floor to give a summary as a discussant in this meeting. This meeting, as we all know, or this webinar, is on the impact of COVID-19 on Africa's prospects of harnessing the demographic dividend. The meeting or the webinar started off by getting a presentation from UNFPA highlighting the importance of the Nairobi Summit and the fact that the Nairobi Summit was an opportunity to reflect on the achievements, challenges, and commitments in completing the unfinished business of Cairo. And we were reminded of the importance of the 3 zeros, which is 0 unintended pregnancies, 0 maternal deaths, and 0 GBV and harmful practices. Beatrice, in her remarks, underscored the importance of mobilization of resources through partnerships with governments and foundations as we advance the agenda of ICPD, and also indicated the UNFPA's commitment to working with national governments to advance ICPD goals and commitments. My short summary is going to be based on a number of themes that have emerged in this webinar. One being the impacts of COVID-19. COVID-19 has had huge implications for youth, women, children, and other populations. There is great potential, and this creates a situation to unravel the gains made pre-COVID across all sectors. Speakers have talked about the widening poverty and inequality gaps loss of employment, loss of income, and disruptions in a number of sectors, and one being health. In health, we noted from the speakers that there were disruptions in health services, increase in GBV, diversion of resources, financial and human resources from other health services to COVID-19, meaning that other aspects of health became under-resourced. In education, speakers brought out the importance of online learning as an alternative to face-to-face learning, but we did also note from the presentations that in education, there were other dire consequences or impacts, which included teenage pregnancies, which we have seen during this time when young people or young girls are away from school, early marriage, and as well as education years lost. We did hear from Bernard that in Kenya, for instance, initially there was decisions to close the whole academic year. Of course, that has been reviewed, but generally speaking, some young people have not been able to return to school during the return to school phase. So those are the impacts. And then our social protection systems have been challenged, as we have heard, especially in the employment sector, as well as household levels. Families have had difficulties coping with the impacts or the consequences of the pandemic. And then there were issues related to urban-rural migration, which was seen as a coping strategy whereby people who had lost jobs in the cities had to return to their rural homes as a coping strategy. Then the other theme that came through in this webinar is the issue of gender and inclusion. From a positive perspective, the presentations reflected youth as a key focus, as well as women, and noting the importance of investing in young people in order to harness the demographic dividend, but also as critical players in development and how and why they need to be on the decision-making table, as we heard from the presentation from the African Union Commission. Women we also saw pointers to the fact that women are key players in decision-making, and not only in decision-making, but also as key players in their own sexual and reproductive health and rights, and also how and when they can have children and also enjoy productive lives at their choice and at their will. The issue of inclusion and equity came out strongly, especially in the discussion around education and the disruption of education activities. And mainly this was around online learning, whereby other families were not able to access internet connectivity because it's just unaffordable. There is no income, and therefore some families cannot afford it. And then on a negative side, which I've already alluded to, is that COVID-19 did affect young girls and women, as I've indicated. Young girls had to drop out of school due to teenage pregnancies and so on. But we also saw and continue to see loss of jobs, particularly jobs held by women. We know that most women are employed in the informal sector, and we all know that during lockdown, nobody was allowed to go out. So the women who are informal traders or who are trading on the streets or in the markets were affected, and affected heavily, because there was no business and there was nobody to procure or purchase those goods. Then let's look at the theme on youth. I think this webinar has underscored the importance of youth. I think this came out strongly from most of the presentations, but let me just dwell a bit more on the presentation from the AUC. We listened to that presentation, which brought out a number of important issues, including the pillars of the demographic dividend, which of course cut across most of the presentations. And I just want to recap those pillars, which are education and employment, education and skills development, health and well-being, rights, governance and youth empowerment. And I think we all recognize that all this revolves and rotates around youth, hence the importance of this topic and this webinar. So I just want to also highlight and recap on the fact that one of the programs, or at least we learned from this meeting, this webinar, that there's the Africa Platform of Action for Youth Empowerment, with a number of action areas being strengthening youth programming, in the implementation of the 1 million by 2021 initiative, catalyzing action at member state level, inter-country peer reviews, and the continental flagship projects. Just want to address myself to the 1 million by 2021 initiative, which highlights a number of key aspects. One being providing 1 million African youth with opportunities in the 4 E's, which are education, entrepreneurship, employment, and engagement, to address out of school and skills mismatch, unemployment, health and well-being, inequality, and disempowerment. So I think those were the cross-cutting, the main themes under the youth section. And then we talked about, we listened to presentations that underscored the importance of data, noting that disruptions in routine data collection for all development programs were stifled during this period of COVID-19 due to the restricted movements. This compelled us to think in an innovative way to adopt new strategies for data collection. And we need to quantify the impact of COVID-19 so as to enable evidence-informed programming and policy actions going forward. Finally, I want to highlight the issues, the lessons learned from the presentation from ECOWAS, and just generally lessons learned from experiences on the continent, which came through from the presentation from ECOWAS. I think we've listened to the presentation in terms of what measures the ECOWAS states took. I think these measures were divided into several categories, one being public health measures, which are social and physical distancing, hand washing, and wearing of masks. Other measures that West Africa took, which is the ECOWAS bloc, measures on travel and mobility, measures in the education sector, measures related to trade and business, as we have listened. The key points that we drew out of that presentation, in addition, is that countries were responsive. They were quick and decisive in their response or in their approach. We also had that the leadership structures, which is the governance or management of the response. And the key points that came out from this point, which I want to really underscore, which I think are important going forward, is that while there is a need for a coordinated approach, but it needs to be connected with the health system, meaning the health sector needs to be at the center. That's the one important message that came out. And then the other message is that the involvement of civil society should remain critical, and where countries have not done so are urged to do so. And I think that's what really came out of the presentation. Also, still on lessons learned from the experiences on the continent, we learn and note that youth are pivotal to the growth and sustainability of the continent, and to fully exploit this demographic dividend that we are talking about. And this can be realized if we increase investments in education, employment, health, and other enablers such as infrastructure, etc. So we just need to invest in human capital, which is quite important. We also need to foster innovation, entrepreneurship, and technology to transform the challenges into opportunities. I think we all realize that during COVID, everybody was working from home. Every task or everything was being done online. And while we had a pandemic, which is a challenge, but harnessing the opportunity that is being availed by innovation and technology is one of the best things that comes out of this experience of COVID, because we've all learned to work online. People are doing business online, and we've been able to strengthen those areas of technology and innovation which were otherwise weak before the pandemic. But we also noted that if we strengthen that, we are going to go far. We are going to capitalize on the opportunities that are availed by technology and innovation. And finally, one of the lessons that we're picking up from the presentations is stakeholder collaboration, and I think that remains critically important. I thank you, moderator. I think this is the end of my short presentation. Thank you.
Thank you very much, Ms. Dudzile Simelani, for your sharing your thoughts, and also your the summary of the presentation, which we have heard earlier. Also, I think the critical aspects emerging from the panelists they shared with us. I really appreciate also your inputs, I mean, from your own perspective, and also from your large experience on issues raised in the presentation. Thank you very much. There are several issues which have been addressed during this webinar, and that may offer good substance for the discussion that we are going to have. And the next, we still have 15 minutes, I think, if organizers would not contradict me, since now time is, okay, it's 9:15 in Bangladesh, but it is 4:45 in South Africa. So we'll go for the first round of questions, and I will invite participants to make 3 questions. We will accept 3 questions first, the first round, and then submit to the panelists, and then we'll see if we still have time. So I can see first from Jack Van Ziden. Jack from South Africa.
Hello, Adnan. Thank you very much, Adnan. And good afternoon, everybody. Particularly fantastic to see so many old friends, including yourself, Adnan, and JFK, and Dudu, and Beatrice. Thanks very much to all the presenters for the fantastic presentations. I think Dudu picked up a bit in her input on the bits and pieces that were said by the presenters around issues related to sexual and reproductive health of young people. But I'd like to basically ask all the presenters in your observations, what has been observed, if anything, concretely in relation to sexual and reproductive health services? One imagines a lot of things. On the one hand, one imagines that maybe health resources have been reprioritized by governments. On the other hand, one imagines that young people, as well as many other people, might be too scared to go to health facilities because they might be scared of contracting COVID there. But do we know anything concretely about the extent to which sexual and reproductive health services are being accessed and utilized by young people during this time of COVID? Do we know also about programs maybe that have been complementary to the UNFPA's World Population Day focus on encouraging people to continue delivering services and using services? So that's just a general question to all the presenters. Thanks very much, Adnan.
Thank you, Jack. Thank you for your question. It's about sexual reproductive health services, which have been accessed by youth during this pandemic. And as I said, it will be addressed to the all panelists, and anyone can intervene. Let me ask Nordin Hassan. I see his hand. Nordin Hassan, you have the floor for your question.
Yes. Thank you. So I was just to remind you that we have several questions in the chat box. If you want me to assist you to rephrase the questions to the presenters, those questions were directed to, that's fine with me. So that was a concern I wanted to raise with you.
Thank you, Nordin. You can summarize the questions, maybe make it as a group of questions, but you can, yes, definitely you can.
Thank you. The first question is from Fiona Clark, and it's about whether we have, and this question was directed to Bernard during the first presentation. It's whether there's evidence about the double impact of COVID on rural households, because you have people migrating back to rural areas, remittances are not coming, and they also still have to deal with all these issues. So that response, that is directed to Ben to respond to. The second question is to our second presenter. The question is asking about whether AU is taking the issue of digital learning seriously, and what strategy is the organization putting in place to make sure that going forward, digital learning and online learning becomes an important part of education, given what COVID has shown. Now, question 3 is to, okay, so the third question, I'm not sure who it was directed to, but the question was whether the capacity to produce quality data that is aggregated in African countries will help policymakers best target and support the pillars of DD. And to our last presenter, the question is about ECOWAS. The question is, to what extent did ECOWAS, or is ECOWAS leveraging on its existing health programs to inform the COVID strategies? Because it seemed each country was doing their own COVID strategies separately from, there was no original program. And then finally, we have this question from Fiona again. How is ECOWAS supporting member states to prepare for the rollout of the COVID-19 vaccine when it becomes available in terms of storage, distribution, application, especially to the vulnerable populations? Thank you. Those were the questions.
Thank you very much, Nordin. Now I give the floor to the panelists to respond, since I don't see any hand raised. So I will ask the panelists to respond to the different questions, and start by, I think.
Yeah.
Yes, Bernard, please.
Yes. So the question from Jacques, the disruption on SRH services that is, was quite real, and at the beginning of the pandemic, when people are not really certain about how it would evolve and things were very scary. there was a dip in facility visits, so that's for sure. And there've also been disruptions on the supply chain. But I think that stakeholders have really gone out of their way to try and resolve this issue. In terms of what evidence is out there, I think there are a number of I'm aware of analysis that is trying to look at the health management information systems, information on services, and so there's a bit of that in there. But again, still at the moment, probably that analysis is not at the level where we can talk about some very concrete numbers that inform how we go forward. The question from Fiona on migration and remittances and the double burden for the receiving communities in rural areas. I think it's a really good question. When people have been, what I've seen is estimates have been looking quite a bit on remittances. I've been looking at the international remittances side of things, but we know that the poorest families in the rural areas actually do benefit quite a lot, or do get quite a bit of support from remittances from within the country, and it's therefore a very important question to address. I'm yet to see evidence that addresses a specific question, but I think there's potential for countries such as South Africa to be able to generate these kind of information from the data systems that they have, including the health and demographic surveillance sites that are there. So it's one to keep an eye for. Yes, there's a question about whether the capacity to produce good quality disaggregated data to support investment in the 4 pillars of the demographic dividend. So whether African countries do have that, and it is definitely an area. Disaggregated data, especially at subnational level, is a challenge. But when you look at 2 of those pillars, I think that there's potential really to strengthen the existing systems, especially for health and for education, to strengthen the administrative data systems to be able to generate this kind of information. And so it's something that people should really look into, and government should be encouraged to really make that administrative data at subnational level quality. Make sure, one, that they put in quality measures, and that it is used for decision making, because usually that doesn't happen. A lot of data is most of it ends up, lying out in the shelves, in computers, and all that. But it really has great potential to be used. Thanks.
Thank you, Bernard. I wish you have any other response from other panelists, but please within a very short 1 minute. I give for the panelists to respond to the questions. Yes.
Yes. Thank you. This is Nicholas.
Yes,
on the question of digital and online learning. I want to start by saying that digital skills are at the heart of skills revolution agenda of the African Union, and indeed one of the flagship projects of the African Plan of Action that I mentioned. And catalyzing action at member states on this, working with private sector players. We've been doing this, particularly during this period of COVID. Partners such as Microsoft, HP, Google, among many others who have foregrounded the issue and assisted with the issue of a digital online learning ecosystem. Then from a continental level, we have developed the digital transformation strategy for Africa, and key areas within this digital transformation strategy for Africa is the harmonization of policy and regulatory frameworks, the issue of digital infrastructure and facilities, and particularly ensuring affordable, accessible, and reliable systems for inclusive digital transformation. As I mentioned in my presentation, investments in one of the critical pillars of the demographic dividend, and that is the education and skills development pillar, is critical, particularly when we include the aspect of digital skills to boost investments in this area. So we are working with member states and partners to catalyze action in this area, and we are hoping that along the road, definitely we will be able to carry everyone along and make sure that it is as inclusive as possible. Thank you, sir.
Thank you very much. If there is any other response from panelists?
Yes.
Before closing, because I need some minutes to close this session.
Jean-François,
yes, Jean-François, you have the floor.
Oh, okay, thank you. Regarding ECOWAS taking leverage of existing health program in the region, yes, we have the West African Health Organization, WOW, which has been playing, which has been instrumental in coordinating a regional response, preparedness response to the COVID-19 pandemic. And they organized in February a meeting with Minister of Health in Bamako. So, but the issue is that actually this issue of COVID-19 is not just about health issues. I mean, as we say, we are over concerned regarding, different development sector like education, economic. And so beyond the health preparedness, we have also the need, to get on board other partners and other stakeholders, and to try to see how we can have a broader and comprehensive responses to the consequences of the pandemic. Thank you.
Thank you very much. I think with the intervention of Jean-François, I think we come to the conclusion of this webinar. I wish to thank the panelists for their great presentation. All the panelists, organizers, and also the discussion, all our partners, the government of South Africa, and so AFIDEP, and also all the partners who have been involved in the organization of this, of the series of webinars. Today we are at the 4th, and there will be another, the 5th one will be next week. I wish also to say that we are all aware that the demographic dividend presents an opportunity to accelerate socioeconomic development and achieve long-term development aspirations of our countries. However, in these times, we are living in unprecedented times, and when the whole world is being ravaged by the COVID-19 pandemic. And this has forced the entire world to rethink the future, including putting in place economic, social, and professional and institutional mechanisms to respond to the pandemic, while at the same time maintaining economic and social cohesion in our countries. Today, we all agree that we have a great opportunity to reap economic benefits from the strategic investment that we made in the continent's current large youthful population. The demographic dividend is the accelerated economic growth that can result from improved reproductive health, a rapid decline in fertility, and the subsequent shift in population age structure, as Bernard explained in the beginning of his presentation. With more people in the labor force, our countries have a window of opportunity, but only if the right social and economic investments and policies are made in health, education, governance, economy, and structure. With the large youth cohorts in our countries, it is therefore imperative that deliberate policy strategies and actions be made to ensure young people's participation in the political, economic, and social systems in our countries. And to make the youth active players, African countries must invest in their education, health, entrepreneurships, skills development, and wealth creation, rights, governance, and youth empowerment as per the pillars of the African Union's roadmap on harnessing the continent's demographic dividend. The biggest question is, how do we enhance the demographic dividend amidst the many challenges that have been presently by the COVID-19 pandemic? This is the question for all of us that we must be ready to provide answers. COVID-19 situation report released by the World Health Organization African Regional Office in late May this year revealed that the average age of most COVID-19 cases ranged between 25 and 55 years. Policymakers must therefore find ways and means of engaging and making productive the continent's youth in order to realize the full demographic dividend and contain the perils occasioned by COVID-19. Yes, we have a heavy task of shaping our demographic structure as a major step toward realizing a demographic dividend and not give a chance to a demographic liability. The situation of COVID-19 as per today, according to the world total coronavirus case, is 51 million, with more than 1 million deaths. And Africa counts itself almost 2 million, representing 3.72% of the total case in the world. 45,000 deaths occurring in Africa. And recovery, they are also improving. According to the United Nations, 226 million youth aged between 15 and 24 lived in Africa. And this represents a great potential for Africa to achieve its demographic dividend. I think the session, we should therefore provide us with the opportunity to identify and discuss the implication of the COVID-19, and it has succeeded with the presentation made by our colleagues. We at the PPD, we are very keenly interested in the discussion and outcomes of this, of all these, the series of this webinar. And I personally wish to announce and invite all of you to attend the PPD and UNFPA, and also the National Health Commission International Interministerial Conference, which is going to be held starting from next week on the 19th, and will be in the format of 2 technical and 1 ministerial session. This year, the 70th International Interministerial Conference on South-South Cooperation, Population and Development will be, the topic will be on Nairobi commitments and the Agenda 2030, taking stock and looking ahead in the post-COVID-19 crisis. The conference will be held in 2, as I said, 2 technical sessions, ministerial session. The first technical session will be on implementation of the Nairobi commitments through South-South cooperation in the post-COVID-19 era, and it will be held on 19 November 2020 from 1:30 p.m. to 3 p.m. GMT Greenwich Mean Time. The second technical session will be on youth engagement through South-South cooperation in advocacy and innovative programming, which will be held on Friday, 27 November, same time. And the ministerial session will be on promoting South-South cooperation for attaining a Nairobi commitment and the Agenda of 2030. It will be held on Tuesday, 8 December, and will close the series of these meetings of the International Interministerial Conference on South-South Cooperation. And I invite you to visit our website, where you will find all the information about these International Interministerial Conference. By this, having said that, I wish to conclude and thank you all for your inputs, your contribution, for reaching this very interesting webinar. And I hope that all the presentation will be shared with the participants. Now I think I've seen the hand of Winnie Adams. Winnie Adams, you want to say something?
Yes, thank you. I just want to thank you as our moderator, the discussions, the panelists, for thought-provoking and very interesting session. I think we can definitely learn from each other. Just about an announcement about the 5th and final webinar. It will be on the 25th of November 2020. This date is, however, subject to change. This will be a webinar for selected invited participants only, but all participants will receive the synthesis of the web series in due course. Thank you, everybody. Good night.
Thank you.
Thank you. Bye.
Thank you.
Goodbye.
Bye-bye.